Welcome to your 2017 annual enrollment. Today, we'll go over some plan basics, introduce some new vendors, and tell you how to enroll in benefits. Working together, we can accomplish a lot. Just look at these employees at City Court. They worked together, held each other accountable, and made a difference, just like we want to make a difference for you. As we go through this presentation, if you have any questions, jot them down and give us a call. Now let's jump into what's new for 2017. This year, we are changing how you elect to take part in the city's My Health Wellness program. First, you'll choose which of the 4 medical plans best suits your needs. Separately, you'll decide if you want to participate in the city's wellness program, My Health. You can elect whether you and your covered spouse want to participate too. The amount of wellness credits you receive will depend on who is participating. Because of this change in selecting your plan options, everyone who wants to enroll in or continue city medical coverage for 2017 will need to complete a 2017 Retiree Annual Enrollment Form. Let's quickly run through what it looks like when you elect your wellness program separate from your medical plan. If you've been around a while, you'll see that nothing has really changed with how you select your medical plan. First, you select your network. A network is just a group of doctors and hospitals who work with a particular medical plan, and you'll save money by seeing providers in your network. In the city's plan, you'll need to choose from either Network S or Network P. The biggest difference between the two networks is Network S does not include the University of Tennessee Medical Center. Network P is the larger network with all of the area hospitals, and it costs more because you'll have access to more providers. Next, you select which deductible is right for you and your family, $500 or $1,000. Here's a chart of the basics of our plans side by side. Notice that both plans cover preventive services at 100%, and both plans have the same out-of-pocket maximums. As we mentioned, joining My Health is now a separate program. The rewards and requirements are very similar to previous years. The premium reduction from previous years now comes in the form of a wellness credit, either $40 if only you or your spouse join, and $80 if you both participate. This credit will offset the medical deduction on your pension check. Plus, you still receive the same RHRA dollars contribution for meeting the requirements of the My Health Wellness program. You can use your RHRA dollars to pay for qualified medical, prescription, dental, and vision expenses incurred by you and your eligible dependents. This includes out-of-pocket expenses that count toward your annual deductible, copays, coinsurance, and other eligible expenses. Not all expenses are eligible, though. You can visit wageworks.com for a complete list of eligible expenses. This web address is listed in your 2017 Guide to Your Retiree Benefits. Those RHRA dollars roll over, too. If you don't spend all of them during the year, they roll over to the next and are available as long as you remain covered by a city-sponsored medical plan. To receive the rewards of the My Health Wellness program, there are a few requirements for you and your covered spouse or qualified domestic partner. First, you must receive an annual health screening at the center. Be physically active and log your activities every month. Beginning December 1st, you can log your activities on a new portal, COKMyHealth.com. Complete quarterly health education, which can also be done on the new portal, and manage any chronic conditions by meeting with your health coach, including tobacco use. If you don't meet the requirements of the program, you may be removed from My Health and miss out on those wellness credits and RHRA dollars. It's all about being active and aware, and then recording the results. Joining My Health can help you change your lifestyle, feel better, and have more energy to get more accomplished. At least that's what it did for Lieutenant Willis, and we couldn't be happier for him. Your prescription drug coverage is part of your medical plan. The city's vendor is OptumRx, and there's a separate ID card. Use your OptumRx card at the pharmacy to pick up prescriptions. Every year, our prescription drug vendor may make changes to the formulary drug list, which may affect where your drugs fall on the copay list. If anything changes, they'll let you know. Pay attention to your mailbox in November. That's how Optum will notify you. Take a look at the next slide to see the copays under our plan. Here are the copays for prescription drugs. Notice all plans have the same prescription drug copays in 2017. Those previously enrolled in medical only will notice a savings from last year's copays. Refer to the drug list at cityofknoxvilleRx.com for a list of commonly prescribed medications. If you have any questions about your coverage, please call City Benefits at 215-2111. We're here to help. So you probably want to know what all of this costs. Here's a chart of your monthly deductions for the medical plans offered in 2017. Great news! All deductions are decreasing from your 2016 amounts. These rates do not include the wellness credit for joining the My Health Wellness program. We'll talk about that next. As promised, here are some examples of what your deductions will look like if both you and your spouse participate in My Health. Did you notice your deduction rate is even less? The city's Health and Wellness Center has a new look, starting with a new vendor and new location. But don't worry, you'll see a lot of familiar faces. The center will be run by Premise Health, effective November 1st. But a lot more is changing than just our vendor. We are adding more staff to offer more services for you and your covered dependents. Sick visits will be covered with a $10 copay, regardless of whether you participate in the My Health Wellness program. All covered dependents ages 2 and up can be seen as well. And as always, the center is where you will go for your screening and to help manage any chronic conditions. You can visit the center at the new Public Works Complex, located at 3131 Morris Avenue, with office hours Monday through Friday from 7 a.m. to 4 p.m. During this transition, Premise will gradually roll out new services throughout the month. Additionally, the center will be closed for training starting November 14th and will reopen on November 28th. You and your dependents will need to be covered on the city's health plan to receive services at the center. Now, it's time to enroll. You have until November 30th to make your 2017 benefit elections. Enrollment packets were sent out to all retirees the last week of October. To remain covered on the plan, you must return the 2017 Retiree Annual Enrollment Form and Medicare Affidavit. Remember, your 2016 elections will not roll over. Also, please take a moment to include an email address for our records if you have one. And make sure we have a current mailing address for you. This will help us communicate with you better. Everything we've talked about is here in your 2017 Guide to Your Retiree Benefits. And as always, the guide is available online at knoxvilletn.gov/benefits. And if you have any questions along the way, Employee Benefits is here to help.